most famous physical therapist on the internet.
Hi folks, I'm Bob Sharp, physical therapist.
Brad Heineck, physical therapist.
Together we have the most famous physical therapists on the internet.
In our opinion, of course,
Got a
Bob.
very cool model to show today.
Oh,
Today
good.
we're going to talk about a back pain
Is
fix.
it male or female?
I don't know, to be honest with you.
Well, we'll find out.
A back pain fix when you should not stretch.
Oh,
There are times when back stretches are very appropriate, and there's times when it'll make your back pain worse.
right.
And we're going to show you one of those times.
Yeah.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com because we're always doing a giveaway. And go to the giveaway section. And this week, we're actually giving away another back pain fix.
Put it this way there so they can read the name.
Yeah.
Thermotex.
Thermotex infrared heating system.
Far infrared.
Far infrared.
That's right.
Yeah, and this is deep heat. Unlike normal heat, which is only like a millimeter.
Normal heat.
Well, radiant heat?
No, this is radiant heat.
Oh, this is radiant.
We don't want to get technical. But
Okay.
anyways, yeah, this will go 2.3.
Like a normal heating pad. Is that a fine?
Yeah, you can call it normal. Yeah.
Okay.
What did you get for $36 at the drugstore? Yeah.
Yeah. This is an expensive one, but it is so much, it will go penetrate so much better. And Brad and I both use these in our respective chairs.
Right, right. Yeah, we've got some videos on some details on it. Anyways, we got to get on with this.
You can go to Facebook. It'll be the contest will be pinned to the top of the page. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program. And
Podcast. We now have podcasts out there going like crazy, and we've got some outstanding
really
interviews.
outstanding interviews. Yeah,
Yep,
you
people
gotta check
from
them out.
all over the world, literally.
So we're going
Anyways,
to demonstrate, the one instance where you don't want to have stretches done to your back.
sure.
Okay, so we got a model here from Dynamic Disc Designs.
Yeah,
Now-
this is a nice model.
Well, these are so realistic;
Yep.
it's unbelievable.
Yep.
And he does a really good job. I mean, this isn't for a lay person to have it in their house.
Yeah,
but this
they're
is for the professional to have.
right in a clinic, so you can show the patient what's going on. Really.
This is my favorite model of all the ones that he has.
Okay,
And
so this is what?
this is the reason I've never had this explained to me like this has. So
But
this
this is the lumbar spine.
this is the lumbar spine, the low back.
Okay, right above the sacrum or the belt line.
Yeah. And you have one disc here that's problematic. All the other discs are normal.
Okay.
This disc has started to wear out. This
Okay.
one right here in the
Right
middle.
here, this
Yeah.
one. Okay.
So we're going to show. Do you want me to do it, Brad?
Yeah,
or-
go ahead.
Okay. Because it's lost some of its stiffness, or turgor as the professional-
turgor?
Yeah. Look at how all the movement occurs right there. So,
So-
like if I'm twisting,
If you look at the blue line, so you have a reference
Yeah.
point.
look how all the movement is occurring there when you twist.
So in other words, where else would it occur? Ideally, it would be divided up between this disc, this disc, this disc, and they would kind of take the
Right.
stress
Take the brunt.
and divide it up. But now, because this is compromised, this disc is, for whatever reason, it's taking the majority of the movement and getting stressed even more.
Even flexing or extending the back, flexing or extend the back.
Yeah.
And also like getting out of bed, Brad.
Yeah.
Like if you get out of bed and you turn like this, you
Ooh,
rotate.
do that again. I mean, see how there's
Yeah.
a big difference in movement there versus the one above and below are not
But
taking
let's
it.
flip this around.
Oh, yes.
And why is this a problem, Brad? So each level has their own two little facet joints.
Right.
Little joints. Now look at the movement here. All the movement is occurring at that same problematic disc level.
Okay, go forward, just hold it there.
Sure.
So these facet joints here are wide open, and the ones down here are still closed. And so,
It's taking more stress.
yep, it's really working all the ligaments and the connective tissue that is not made for that.
Right. And it's wearing this joint out quicker
Yeah.
too, though. So that's when you're going to start. You just move slightly and you're, oh, that hurts.
Yeah,
So with this type of person, you don't want to stretch because
Mm-hmm.
you can't stretch these individually.
yeah.
So what you want to do is actually, you want to support it. You want to increase the core strength.
Strengthen,
You want to strengthen it.
Yeah.
Yes. So,
stabilize. We want to stabilize through the core strength.
So do you have this? We're going to find out. We're going to show you two tests you can do to determine whether or not
Yeah.
you might have this right now.
Okay, good.
So the heel drop, that's number one. So I want you to first do it with no stability. Just let everything relax.
Allow your stomach
Yep.
to relax.
And you just lift up like this and you drop onto your heel.
So just
Yep.
ooh.
Now try it with tightening up your abdominal muscles. You might even do your lats and pecs. That's anti-shrugging, like push down like this.
Okay.
And all those come in with the fascia,
Right.
remember?
So it all works the
Yeah.
core together. So we're really trying a good solid core.
And then do the heel
You
drop.
could feel your stomach muscles.
Yep.
You should feel them become a little harder.
And if you had pain with the heel drop,
Mhm.
and you didn't have pain once you stabilized,
Yep.
that makes me think that you might have some instability in your
So
back.
you invented this test?
No, this is Dr. McGill.
Okay, it's Dr. Stuart McGill.
Yeah.
And we actually got a podcast with him. He's an expert leader in the field.
He is the expert, I would say,
Right.
in the world. And I think his book is probably one of the best, The Back Mechanic.
Yeah. Well, he's got quite a few books.
Yeah,
but yeah,
and
that's
this
a good
is
one.
in there. These tests.
Yep.
The other one, Brad. Where's my weight over here?
Oh.
So you take a weight, like I'm taking a 5-pound weight. I'm going to hold it at my belt buckle, and then I'm going to extend it out like this and back like this.
Yep.
I'll do it from the side here,
Sure.
like this. And now my back is having to work when I bring it out here, and I'm not stabilized yet.
Okay.
So now I'm going to see, was that painful?
Yep.
I say, yes, it was painful. Now I'm going to tighten the core again. Same thing, lats.
It's kind of like putting on a back belt.
Yep, exactly.
Or a brace.
Now I'm going to go out and back, and it's better.
Mhm.
I'm assuming. Again, if you have instability in your back, that would be the case.
Sure.
And, a good example is right when you get out of bed. I've had this with patients before. They're going, God, it just hurts right away when I wake up in the morning. I try to get out of bed. Well, they're getting out of bed without tightening their core.
Right.
And because of that, they're having pain. We have them tighten their core. They can get out of bed without increased pain.
Stabilizes all that movement of a compromised area, the disc.
Right. Okay, Brad, I'm going to show
Oh.
Stuart McGill's big three.
So we're talking stretches or core exercises?
Three core exercises.
So if these tests are both positive, these would be these would be the ones to
these
work
are the
with.
ones to do.
Yep.
You won't be doing stretching. You'll be doing these instead. So first, we want to strengthen the core. We're going to strengthen the rectus abdominis,
Sure.
the muscle, that triple muscles right there, and
The old six-pack muscles.
you get the obliques a little bit too. But he likes you to put your hands right underneath your back to give it a little bit support. You lift your elbows because he doesn't want you pushing up on your elbows.
Sure.
and
It
help
helps
out.
isolate.
Yeah.
You want that pillow there?
Yeah.
Okay.
I want the pillow.
All
Well,
right.
I suppose I'm going straight up like this, Brad.
Oh, okay.
So now
Good.
I'm sorry. I do it when I lift my legs up like
Be
this.
careful of your mic.
Yeah.
Bob.
But he actually just has you lift up like this. So you're going straight up, not like this. You're going straight up. 1, 2, 3, 4, 5.
Trying
1,
to
2,
minimize
3, 4,
stress on
5.
the neck and
Yep.
stress the muscles that we want.
Well, you're not trying to curve the back either.
Yeah, right.
So straight up like this.
So you're lifting up your elbows, and that makes a tremendous difference
Yes.
when you do it that way. You'll notice it.
When you first start these, Brad, your neck might get sore. Mine
Yep,
did,
yep.
actually, from this. So, all right, the next one is actually, I'm going to go ahead and run to the side here. You'll do this on both sides. But
Sure. Oh, you want me to?
get that out of the way.
Oh, I have to take a nap.
All right, next one is we're going to get some planking, side planks.
Sure. Yep.
Now, you could start these on your knees like this. So
Yep.
You line up your knees together, and you're just going to lift up like this, and you're going to hold it.
So we got the gap here. The hips are off on the elbow, and you're not going to do this one on your bed, right, Bob?
No.
You
no.
need to pretty much do it on a carpeted
Exactly.
floor or a mat.
Exactly.
Mhm.
And, if you want to do more advanced, you
Ooh.
go ahead and straighten the legs like
This
this.
is more advanced.
Yeah.
If you don't get to this point, don't feel bad. It personally bothers my back. I do some other options.
Sure.
You may have a back condition that, and depending on your age too,
If you want to do, of course, both sides,
Yep.
even things out.
right?
The
left.
last one is the quadruped position. Right?
Oh,
so we're going
yes.
to go ahead and
All
get up
fours.
on all fours, and we're going to go ahead and lift up like this. and lift up the,
Now,
keep
look,
the head down like
so
this.
the goal is to be nice and straight. And Bob tightens his core up and gets that neutral position
Right.
actually before the legs and the arm move.
Exactly, Brad.
And that really does a nice job, particularly on the muscles on the back, which a lot of people miss with core strengthening.
So you can do both sides.
Look at that. You've been practicing, huh, Bob?
Oh, I've been doing this.
Yeah.
I've been doing all 3 of them.
And this one, I don't know if Dr. McGill calls it the pointer dog, but I do.
Yeah,
The pointer dog.
exactly.
You know,
It's a
either
good
setter
visual.
or whatever dogs
Yeah,
point.
it's a good visual, and it's great for you're getting the core, you're getting the back too.
Yeah.
I mean, the core and the back, of
Yep.
course. So you try those out. You can do them every day if you like.
Yeah.
And,
You may not want it right away, but as your muscles get used to
Right.
it and some muscle soreness gets out, you probably will want to. They don't take that long once you get into the
then you
groove.
learn to tighten that core whenever you're doing work. Like when I'm shoveling snow, it's amazing what difference it
Mhm.
makes.
Yep.
When I tighten that core versus not tightening the core.
Yeah.
So-
And it, that's one of those things you want to have become a habit.
Also, if you have your kids that want to, come up, hit me in the stomach, and get ready for that. So, did you ever do that?
Is your Matt, your adult son?
No,
is
I'm not
6
gonna have
foot-
him.
He's benching 300
Yeah,
pounds.
He crushed me.
That would be a good video.
Yeah, that'd be it.
Hit your dad.
Yeah.
Check his core strength. We got to get,
Remember,
We're
Brad and I can
digressing.
fix it about anything.
except for,
Broken heart,
Broken
or
heart.
broken spine.
yeah, the
too.
core exercises we don't think is going to help that.
No.
But we'll do a double blind study.
Yeah, there we go. Thanks
Carry
for
on.
watching.